Hello, my name is Dr. Anju Varghese. I'm a specialist in Obstetrics and Gynecology working at Ahalia Hospital, Hamdan. Today I am here to talk to you a few words about postpartum care. What is this postpartum care? Postpartum period refers to the time after childbirth and 6 weeks following that. This is an exciting time certainly, because if you have reached this period, it means that you have completed 9 months of pregnancy and those long hours of childbirth, and now you're officially a mother. So congratulations first of all. And let me remind you one more thing, that at this time, even though it is an exciting period definitely, this is a time that the mothers have to remember that they have to care more for themselves, because the body is undergoing a lot of healing and recovery at this time. So I would like to give some suggestions to ensure a healthy postpartum recovery. Firstly, the most important is to get enough rest. There is an old adage that says, sleep when the baby sleeps. This is not so easy, I know definitely, but try to get as much help as possible so that you don't miss out on your naps. You can ask help from your family members, your husband, relatives, or even get a hired help for a few hours a day so that you are able to get some rest. Next is about the diet. During pregnancy, it is very important, everyone knows about diet and everyone concentrates on eating healthy food, eating on time and all those things. But many of them forget after delivery that it's as important as before. So we have two extremes. We have people, we see many often, pregnant mothers who don't eat on time. They skip their meals because they are so overworked and so stressed out, and they miss out on their diet. And the other extreme we see is that they overeat or eat any sort of foods like junk foods and every sort of foods, and they gain weight during the postpartum period. Both these extremes are not healthy for the mother and the baby. So it's important to concentrate on the type of foods you eat and to eat on time. A balanced diet consists of enough fruits, vegetables and proteins. It's also important to drink plenty of liquids and to avoid alcohol and caffeine if you're breastfeeding. Another important concern is exercise. Your doctor will let you know when it is okay to exercise, because that depends on whether you had a normal vaginal delivery or a cesarean section. But the simplest rule is that walking can be started at any time. Like once the pain and the soreness of the delivery is over and you're not feeling any pain, it is okay to start walking. Walking tones up your muscles, is a good mood booster too, and if you're doing an early morning walk, it gives you your daily dose of vitamin D. It's also important not to forget about Kegels exercises. These are exercises meant to strengthen the lax muscles around the vagina, and this can be started again once the soreness around that area is less. This is done by tightening the muscles around the vagina and the anal canal, and it is done as if you're holding your urine and trying not to urinate. These muscles can be held like this for 5 seconds at a time and relaxed, and repeat this as 10 sets 3 times a day. Moving on, I would also say a few words about the emotional well-being of a woman, because this is as important as the physical well-being. It's very common in the postpartum period for women to experience some form of anxiety, sleeplessness, emotional upset and crying. This is so common that it's called as postpartum blues. It lasts up to 2 weeks in the postpartum period, and it is due to the overdose of hormones occurring in the body and the stress and strain of taking care of the baby. But this, as I said, gets better in a few weeks. If it is lasting longer than this time, or the mother is experiencing such severe symptoms as to interfere with her daily routine, it is important to seek help. So definitely you have to meet the doctor and seek her help if you're having any concerns like this. Last but not the least, you should also talk about birth control options with your doctor, at least during the first postpartum visit. Because a healthy pregnancy also refers to avoiding pregnancy for at least 2 years after delivery. So spacing the pregnancy is quite important. I hope these suggestions will be helpful to you in aiding you through this journey in this period of your life. I know it's a stressful period at first, but you have to remember that this will pass, and caring for a newborn gets easier as time goes by. So relax, don't stress it out, and I wish you all the best. Thank you.